CoOportunity Health was a program in Nebraska and Iowa that left 120,000 Nebraskans and Iowans without coverage, some of whom were on that plan, having lost the plan that the previous plan that they were told they could keep, but they lost anyway. Should there be, in your opinion, an opportunity for those folks to be waived from the individual mandate while they continue to shop because they were removed from the plan that, well, I guess no longer existed? Should they be able to take more time or have the waiver to find coverage?
Well, as I understand it, the insurance departments in Nebraska and Iowa are working very closely with other health carriers in the state to make sure that there's a seamless transition for folks who were enrolled with CoOportunity Health. So ideally, there would be very, very few people who would experience a gap in coverage of any significant length. I will also say that the mandate—
Should they be required to pay a penalty?
Well, the mandate penalty only kicks in if you've been uninsured for 3 months. So for folks who are able to move into another plan, and I think the goal for both states is to really ensure a seamless transition for folks. They really should not be without coverage for as much as 3 months. That would be surprising
I can't suggest anyone would be without coverage as a good idea.
Right.
I mean, notwithstanding any mandate, I think it's a good idea to have health insurance. But many of these plans, I mean, the pattern that I have observed among Nebraskans is that the plans are more expensive, the premiums are higher, the copays are higher. In fact, the copays are so much higher that some providers are seeing people walk away from those high copays, still leaving uncompensated care. These patterns are there, and I suppose some numbers, we can extrapolate from some numbers and say, well, it could be a lot worse. I have a hard time standing in front of Nebraskans and telling them that, especially when they have experienced what I would say pretty extreme situations are relating to their finances and the increasing cost of health care.